Hello everyone, welcome back. Here are the 5 things that I learned from my parents and from my own experience. How to live aging gracefully and aging healthy. I think those 2 things are synonymous. Number 1, find a passion, find a hobby, something that you really like to do. The second thing is live in an area that has all the resources that you need, particularly a hospital system. The third thing is don't rely on your kids to take care of you at the later stages of your life. Get your financial in order. The fourth thing is understand your medical insurance and what that looks like as you age. And I think this is really important for your younger self. If you're in your 20s and your 30s and you're watching this, I think this is the most important thing, and that is do not take advantage of your health. And I'll explain all those things in this video. Let's begin. It's extremely important that as we age, we find something that we're passionate about. Find something you like doing. A lot of times, my parents complain about how bored they are because they have become less active. Their hobbies were non-existent because growing up as a child of an immigrant, my parents worked a lot. Sometimes they had worked in full-time jobs as well as having side businesses. So we really didn't have a lot of time for any extracurricular activities. But now I realize that even a 15-minute walk around the block, let's say, is gonna do so much wonder for your later years. Not only does it help with clearing the mind, but it also helps with the minimal physical activities that you need in order to stay healthy, particularly in terms of cardiovascular health. Find a hobby that you enjoy. For myself, I started yoga many years ago. That's one of my passions. Moving for me helps me think and clear my mind. It's a way of also getting that physical activity you need. The most important thing about picking up a hobby is something that you really enjoy. Keep an open mind and insert some kind of hobby activity. Insert that in your life. The reason I usually do yoga and other physical activities like CrossFit or even Muay Thai is because I am surrounded by most of the time, younger folks, and they keep me young. They keep me young, not just physically, but also keep, my mind still engaged in what is relevant in today's world. Number 2, be close to the resources that you need, particularly the hospital system, food supply, stores that gives you the benefit of choosing fresh fruits and vegetables. Be in an environment that has less of the fast food stores, because a lot of times you might be crunched for time and that might be the best solution, but in the long term it's super unhealthy. So if you could live in an area that is close to some of the resources that's going to keep you healthy, particularly when it comes to selection of your foods, as well as place to get your exercise. Another thing that could save you time in the long run is to find your job close to your home. On average, Americans spend about an hour driving to and from work. So if you can work remotely or shorten that time where you need to drive to a place for your work, that is going to add more time to where you could exercise or find a hobby that works for you in that given time. Get your finances in order. Hopefully that during retirement you will be financially independent. Most of us are going to rely on Social Security. Some of us will have some substantial savings It's really hard to think ahead about your finances. If you are 20 or even your 30s and you're watching this, we might not even have Social Security. And Social Security does not pay out that much. And if you're living in an area like Los Angeles where the rent is extremely high, one-bedroom apartment could be around $2,000 based on where you're living. If I were to go back and tell my younger self, I wish someone had said, think about your finances, get those in order, have a large chunk of your money saved or invested in a home or something that's going to yield you more money or income every year. Those are things that I think a lot of times where the younger people do not think about, but I urge you, if you're in your 20s and 30s, really think about what your retirement looks like. When you're ready to retire at 64, you might have to extend that and work a little longer, and that's a lot of times, that's what most people have to do to supplement their Social Security income. One statistics indicates that there's about 10% of people age 65 that are considered to be in the poverty level. That's around 6 to 8 million people. If you don't think about the long-term financial stability for yourself, by the time you are in your 50s, you might not have that window of opportunity to have enough savings or have enough investments or resources that's going to keep you out of poverty when you are at the retirement age. When you're healthy, you don't think about health because why would you, right? Most people focus on problems. They don't focus on things that are good. Most of us, once we reach 65, we will enroll in Medicare. But one thing about Medicare is that you will be paying out of pocket to get at least Part B of Medicare. Part B does not cover certain things like most dental work, any optical care, or hearing. So those are important things that if you are going to be needing that, for me, I will need eyeglasses the rest of my life. I will need to supplement my Medicare B with something called Medicare Advantage, which is a third-party company that administers Medicare for you, getting the Medicare insurance to pay out. But they also pay for the services that are not covered with Medicare B. At the premium right now, Part B, you're paying at minimum, last time I checked, around $174 a month. With the Medicare Advantage, which covers the non-covered things in Part B, my parents are paying about $250, $260 a month. I don't know about you, but I think $250 to pay for the rest of your life, I think that's a lot. Part D covers medication, but certain types of medication are quite expensive, regardless whether they're covered under Part D. There is no real standardization of medication prices, unfortunately. So it can add up. My dad, he's now having to take medication that is going to help him reduce risk for blood clots. And those medications are now, with the insurance, about $150 to $200 a month. This medication is better than another medication, although the other medication is quite less expensive. But this medication, research says it's better for people who are up in my dad's age, which is in his 80s. Medicare, I think it's a great system. Most people will not be able to opt out of Medicare and finance their own health insurance. 5, don't take advantage of your health. When you're young, you forget about health because you're already feeling good. You're young, you have other things to worry about. Keep in the back of your head, back of your mind that health is going to be with you, whether you're in an unhealthy state or a healthy state. Most of us think about things that are negative, that there's something wrong. So if you don't have the symptoms, it's not going to be something that you think about. If you're in your 20s, 30s, and 40s, one of the things I think that is going to benefit for you in the long run is take your blood pressure and see if it's high. Make sure when you do these blood pressure measurements that you are sitting and that your arm is not above your heart level. There are guides in how to take proper blood pressure measurements, and that's by American Heart Association puts out. I'll go ahead and put a link down below. Also, blood glucose levels, so your sugar levels. If you have a tendency, or if you have a diet that is a lot of sugar, so if you are going to fast foods, if your hydration consists of a lot of soda, if you haven't already, take a look at the sugar content of these drinks. It's most likely they're going to have some form of sugar, whether it be fructose, whether it be some other oose. Those are things that you want to check and make sure that glucose, fructose, those are all type of sugars that is going to spike your blood glucose level. Particularly in your 20s and 30s, have an annual blood work where have the doctors take your blood and look for glucose levels. It's so important. There's one other blood setting, A1C level. It tells you a historical view of your glucose level. Anything that's below 5.7% is considered normal. I'm pre-diabetic. My level is around 6%. Those A1C numbers are important to know whether you have high glucose, blood glucose levels for a month at a time, and whether it's a chronic condition. If it is a chronic condition, that's something that you would need to go and see your doctor. And hopefully, if you change your diet and maybe lose some weight if you're overweight, because that's a risk factor for diabetes and high blood pressure, that can help you reduce and maintain a healthier blood glucose level. It's some of the things that I'm working on myself because I'm pre-diabetic, so I really have to watch for my sugar intake as well as getting enough exercise. I love fruits, as a lot of Asians. One of our thing is that we eat fruits practically every meal. Both of my parents like fruits as well, but they're diabetic. So I have possibly a genetic component. I really need to watch out for that. I've cut down on my fruit intake. I don't drink any type of beverages high in sugar. I don't think I drank Coke since I was a teenager. These chronic diseases that you can develop, and in most part, they could be silent, meaning they don't show any symptoms until your body can't compensate for the high glucose or the high blood sugar or high blood pressure. Then you might end up having these symptoms. But by that time, you might have already developed full-blown diabetes or full-blown high blood pressure or hypertension, in which case you'll need medication for the rest of your life, most likely. In your 20s and 30s, 40s, whether you do have insurance or not, please check at least those two components, your blood pressure and your blood glucose. That will be very helpful in the long run. Thank you everyone for watching this video. I know it's kind of a long one, but I think it's important to go over those 5 things. I probably will come up with other things that will help you to live a healthy life. Until next time, bye now.